Nigeria, inarguably the most popular black nation in the world, often referred to as the Giant of Africa, with an estimated population of 174 million citizens, which make up her most valuable natural resource, humans, is a beautiful country located in West Africa, bordered by Benin Republic in the west, Chad and Cameroon in the east, and Niger Republic in the north, with breathtaking natural greenery, awe-inspiring landscapes, yes, flora and fauna, with an abundance of naturally occurring mineral and natural resources, of which crude oil could be called the most important, as it has shaped her economy. It is therefore not hard to imagine why she is so envied by the world as a paradise. But every paradise has her snakes. In the year 2000, at the Millennium Summit held in New York, Nigeria and 188 other nations of the world met and agreed on a number of development goals that would, if properly strived for, ensure the improvement and general development of their people by the year 2015. Of these goals agreed upon, two of them, namely, to reduce child mortality. To improve maternal health is still of great concern to the nation, as many women and children still die unnecessarily in deaths that are actually preventable when compared to most other countries in the globe, with an alarming estimate of 53,000 women dying each year, which translates to a woman every 10 minutes, and about 1 million children under the age of 5 dying every year, that is, 114 children passing away every hour. While this may look too technical to comprehend, breaking down the realities further in order to simplify them, we have an official estimate of 145 women and 2,300 children dying every single day, making the country the second largest contributor to the under 5 and maternal mortality rate in the world, according to UNICEF statistics. This tragic situation is further complicated up in the remote areas of northern Nigeria, where primary health care is seemingly reaching new lows due to several contributing factors like insufficient and inappropriate home-based care of pregnant women and newborns, lack of sufficiently trained healthcare personnel, poor means of transportation from the homes to the hospitals, lack of affordable emergency maternal health care, to mention but a few. However, a select set of people have made themselves available to turn back the red hand of death that was for a long time spreading to pregnant mothers and children in northern Nigeria. This is the soul-stirring tale of miracle workers, where we shall explore the good work the Partnership for Reviving Routine Immunization in Nigeria, Maternal, Newborn and Child Health Initiative, PRRINN, MNCH, have done in Unguwar Agage, Danja, Katsina State. This is the tale of the miracle workers of Unguwar Agage. The PRRINN MNCH commenced operation in Katsina in the year 2008, at which time Unguwar Agage had an average of 5 maternal-related cases almost every week. This tragic situation, as expected, was the birth of very frightening and traumatizing experiences for would-be mothers, as imminent death stared them right through the eye, hence causing them to view childbirth more like a curse instead of the blessing it really is meant to be. Then news came. News about the help that PRRINN MNCH could offer to alleviate this dark trend. And although initially few were skeptical, as a misinterpretation of religion and the role played by tradition and the pre-existing culture of the people had imposed its sentiments and barriers, the religious leaders of Unguwar Agage still invited praying MNCH over for a training. And then the story took a different turn. First, campaign MNCH began with training community volunteers to increase their reach, arming them with information which became a major tactic in reducing these deaths. This, coupled with setting up maternal health care centers, drivers, a blood donor group for emergency situation, a savings scheme to help procure financial enlightenment, and medical personnel from the community. Deaths were reduced till Unguwa Agage today, for the past 2 years, boasts of not a single death recorded in 2 years. Let us take a look at what community volunteers, beneficiaries, and leaders have to tell us about their experiences.
This organization wants women who have babies to know that it is highly expected of them to go for checks in the hospital so that they can get proper medication for themselves and prevent medication for their children. This organization has enlightened us so much on the issue of child and maternal health care, and we have had fewer problems after adhering to the method you put in place for us to follow and use. We were told to not let our wives consume traditional concussion when pregnant, so they now visit hospitals for checks even when their husbands are not around.
So Alhamdulillah,
my name is Sadia Idris. I've learned so many things since this organization came to this place. I started showing signs of childbirth at about 8 a.m. and a driver was called to rush me to the hospital. When we got there, they said I needed blood, so they had to call someone from the blood donation group. And while they were transfusing the blood, I gave birth to my child. I really want to thank this organization and pray God to bless them and make them much more prosperous.
We lacked the knowledge of blood donation before this organization came to this town. When in need of blood for either your wife or your child, you have to buy at the hospital. So what we do now is when someone is taken to the hospital and he needs blood, we try to find out whose blood group matches and they donate to the person in need. We have blood group members in abundance.
When I was pregnant, I got sick and needed blood. And when my husband spoke to the blood donating group, they brought about 6 people and there was no match after 3 were tested. But we were lucky enough to get from the other 3 and I got well afterwards. This is one of the numerous benefits I have enjoyed from this organization. We have learned a lot from this organization, especially in terms of childbirth, pregnancy, and how to take care of our children. Truth it is, before now, we had no idea of so many of these things. When a pregnant woman got ill, we would just self-medicate. But after these organizations' messages and advice, we no longer take the risk of taking traditional herbs or administering drugs by ourselves. I am a low-level facilitator and I supervise about 9 communities. While some are close to each other, some are not, but I always visit these communities to make sure that I sit with the women and sensitize them on the need for visiting the hospital when they are pregnant. In every community, we have about 12 young girls and 2 elderly ones who represent them. This project has recorded success because of the unity and patience the organization, we facilitators, and the women have exhibited.
My name is Alhatu Sani Yaro Anja. As a facilitator for the organization in this local government, I was able to coordinate between 18 wards, and in every ward there are 6 people. So I go around as the facilitator to monitor what they are doing and correct them where there is need to do so that the work can go on smoothly. It has been on also in other local government areas of Katsina State, where it is only in our local government that a community has gone about 2 years and a half without recording death during or after childbirth. First, this can be attributed to the unity among the residents, and also the way we were able to pass the message to the people, and we sincerely thank God for the success.
Even though print is going, we still have the communities are there, the people are there. We really know, prior to the inception of the program, like I've said, we did the baseline, we know the situation, and now we have really changed their lifestyle now, because what they acquire now, the knowledge they acquire, will really change their mind, will really change their attitude, their practice. So this will definitely move the project even with the exit of the print.